Some doctors have told ITV News they're resigned to knowing next year may be no different.
Well, we did request an interview with either our Health Secretary or the Chief Executive of the NHS in Wales, but we were told it was too difficult for them to do interviews today. However, speaking on their behalf was Vanessa Young from the Welsh NHS Confederation, the membership organisation for the 7 health boards and 3 trusts. I began by asking her for her take on the situation across Wales.
We represent the leadership of the NHS in Wales and provide a voice on their behalf, and so our members are telling us that it's a very challenging situation for them at the moment. It's always difficult just immediately after the New Year bank holiday, and they're working very hard to implement the winter plans that they have developed over the last few months with support from the Welsh Government in terms of some financial support to help them with that, but it is a very challenging time.
Well, the Royal College of Emergency Medicine, as you know, have gone a step further from challenging to say that patient safety is being compromised. Would you agree with that?
It's a situation that we're monitoring daily, and as I say, we have these winter plans in place and they're being implemented. Some pre-planned surgeries in the early part of January have been postponed as part of those plans, but the services, the staff in the NHS are working very hard to manage the level of demand that we're seeing. We would of course encourage the public to choose well and only go to A&E if they're absolutely necessary.
This can't just be down to the public choosing well, though. The College of Emergency Medicine made it very clear they'd like to see urgent action in terms of more beds, more doctors and more nurses, because there just isn't the facilities to cope at the moment.
There have been, in some health boards, they have created more capacity with extra beds for this time of year, as I say, as part of the winter plans that they've developed. They're also working hard with local authority colleagues and extending services in the community to provide stay-at-home services during this period. So it is a whole system issue. It isn't just about A&E, it is about all parts of the system working together. And this year, more than ever, our winter plans have been better prepared and are more robust than they have been in previous years. And we have had additional support from the Welsh Government to help facilitate that. And that means that at the moment it's very challenging, but the system is coping.
If the best plans possible were in place this year, why are we talking about more financial support, as you mentioned earlier, operations being cancelled, as you've mentioned as well, and are we going to hear more on this and another part of a plan now that things are getting worse?
Operations haven't been cancelled, they may have been postponed as part of the plan. So it isn't right to say that they've been cancelled, they've been postponed. And each year, as part of the planning process, health boards work hard to put in place plans for what we know will be a difficult time of year. They are monitoring the situation daily and adapting those plans to take account of that. And we will keep monitoring that situation. As I say, the staff are dedicated. Staff are working very hard and putting in more hours than usual in many cases to try and accommodate the demand that we're seeing. And we are keeping the system and monitoring the situation closely.
Vanessa Young, thanks very much for your time this evening.